Hello everyone. Thank you for your time today. We will present about suicidal ideation in people with chronic illness during COVID-19, the roles of stress, occupational burnout, and depression. Before we start, I'd like to briefly introduce ourselves. My name is Eunjeong, and I'm a doctor candidate in the Department of Rehabilitation Psychology and Special Education.
Hello, I'm Hill, and I work at Korean Problem Gambling Agency, and I graduated Hanwha Global University.
Hello, everyone. My name is Minju Lee, and I'm a doctoral candidate at MSU, Michigan State, and my major is counselor education and counselor education and supervision.
All right. Thank you all. So today, I hope after this presentation, we can describe how the COVID-19 pandemic intensified the psychological distress among individuals with chronic illness and disabilities. And also, we will be able to explain the role of occupational burnout as a key mechanism linking pandemic-related stress to depression and suicidal ideation. And finally, we will discuss the implications of the findings for workplace and mental health interventions targeting vulnerable populations. So, introduction. The COVID-19 pandemic has profoundly reshaped the global mental health landscape. Across the world, as you know, people have experienced unprecedented levels of uncertainty, fear, and social isolation. Among the most affected were individuals with chronic illness and disabilities. They faced not only the threat of infection, but also disruptions in healthcare services, isolation from social networks, and increased economic and occupational stress. These overlapping stressors represent what scholars have called a syndemic, which is a situation where multiple health and social crises interact and amplify one another's effects. For marginalized groups like individuals with chronic illness, this syndemic condition created disproportionate psychological distress. In particular, the workplace became a critical setting where these combined stressors converged, leading to greater occupational burnout and emotional strain among workers managing chronic health conditions. So, individuals with chronic illness consistently report higher levels of depression, anxiety, and suicide ideation compared to people without chronic illness. Even before the pandemic, they carried a heavy psychological burden because of their ongoing health management, treatment-related stress, and social stigma. During the COVID-19 pandemic, these challenges intensified. Healthcare disruptions, limited access to regular treatment, and social distancing measures increased isolation. Many also experienced heightened uncertainty about their job stability and health safety. In this context, perceived stress, which is the appraisal that one's life is unpredictable, uncontrollable, and overwhelming, this perceived stress became particularly pronounced. This chronic stress exposure heightened vulnerability to mental health problems and laid the foundation for more severe psychological outcomes. In workplace settings, pandemic-related changes created additional challenges. Many people managing chronic illness faced remote work barriers, reduced organizational support, and health-related stigma. Such ongoing stressors led to occupational burnout, which is a psychological condition characterized by emotional exertion, depersonalization, and reduced professional accomplishment. Burnout is not simply a job-related problem. It functions as a bridge between external stress, like COVID-19 related perceived stress, and internal psychological distress. During the pandemic, burnout emerged as a crucial pathway through which perceived stress translated into mental health challenges among vulnerable workers. To understand these mechanisms, we use this study is based on Perlin's stress process model. The model explains how stress proliferates across different life domains. Primary stressors, such as chronic illness, can lead to secondary stressors like workplace strain or financial difficulties. These stressors interact and accumulate, eventually resulting in adverse mental health outcomes, such as psychological distress. Within this framework, occupational burnout operates as a sequential mediator, linking perceived stress to depression and suicidal ideation. With this space, we'd like to examine the sequential mediation model that explains how perceived stress contributes to suicidal ideation through occupational burnout and depression among South Korean workers with chronic illness. So we have these two research questions. First, what are the direct relationship among perceived stress, occupational burnout, depression, and suicidal ideation? Second, do occupational burnout and depression sequentially mediate the relationship between perceived stress and suicidal ideation? Through this model, our study aims to clarify the mechanisms through which stress proliferates to highlight critical points for prevention and intervention in workplace and community settings.
Okay, let's start. This study used secondary data collected from adults in South Korea. The data were originally gathered to examine the psychosocial impact of the COVID-19 pandemic. Among 1,434 participants, we selected 195 individuals who reported having a chronic illness. Next, please. Perceived stress was measured using the Korean version of the PSS with 10 items rated from 0 to 4. It measured both positive and negative perception of stress, and the reliability was good with Cronbach alpha of 0.79. And suicidal ideation was measured using the Korean version of the DSISS. These 4-item screening tool evaluate the frequency, controllability, and intensity of suicidal thoughts during the past 2 weeks. The scale showed excellent reliability with a Cronbach alpha of 0.94. Occupational burnout was measured with the Korean version of the MBIGS. It consists of 3 subscales, and it rates on a 7-point scale from never to every day. High score indicate greater burnout, and the reliability was excellent, with a Cronbach alpha of 0.92. And last, depression was assessed using the Korean version of the CESD-10, a brief 10-item scale with binary responses. Scores of 3 or higher indicate depressive symptoms, and the reliability was strong, with a Cronbach alpha of 0.85. All analyses were conducted using Jamovi program. We used past analysis to test whether burnout and depression sequentially mediate the link between stress and suicidal ideation. Model fit was evaluated using indices such as the CFI, TLI, and RMSEA. We also use bootstrapping to estimate the significance of the indirect effect. Let's move on to the result. Their average age was about almost 84 years, and most were male, middle class or above, and full-time workers. All variables showed significant positive correlation. The normality assumptions were met, as kinase and kurtosis values fell within acceptable ranges. For the overall model, the chi-square test was significant, which is expected given our sample size. However, other indices demonstrate an acceptable fit. This value confirmed that the proposed sequence mediation model fit the data reasonably well. The past analysis revealed significant direct relationship among all variables. Perceived stress significantly predict occupational burnout with a standard coefficient of 0.45. Occupational burnout predict depression with 0.43, and depression predicts suicidal ideation with 0.33, all at the 0.001 level. The indirect effects were also significant, showing that perceived stress indirectly affected depression and suicidal ideation, and burnout indirectly affected suicidal ideation through depression. These results indicate that the effect of perceived stress on suicidal ideation was not direct, but rather sequential mediated by burnout and depression. In short, people with chronic illness who perceived more stress were more likely to experience occupational burnout and depression, which in turn increased suicidal ideation. This spurred the Portland's stress process model, showing how stress spread across emotional domains. Our findings highlight the need for early intervention on burnout to reduce depression and suicidal risk.
Now I'm gonna move on to the discussion and limitation and implication section. So basically our study found was our study found was a sequencer pathway linking pandemic related stress to suicidal ideation through the occupational burnout and depression. So during the pandemic, individuals with chronic illness faced multiple stressors such as disruptive access to care, isolation, and workplace pressure, and so on. So which together created a syndemic situation like Eunjeong and Jinhee also introduced. So our model showed that occupational burnout acts as a bridge, so turning stress into emotional exhaustion and depressive symptoms, which then lead to suicidal thoughts. So this really supports Piolin's stress process model, showing how stress can multiply and spread across the domain of life. So burnout, burnout isn't just an outcome of stress, but also it is a key mechanisms that connect stress to the suicidality. Next, please. So it is also important to note that burnout and depression are not the same thing, even though they are very overlapping. So there has been debate about whether burnout is just another form of depression, but our data suggests that they're distinct components. So in our model, burnout did not directly predict suicidal ideation unless depression was present. So that means depression actually mediates the effects of burnout on suicidal thoughts. So what we are seeing here is that burnout comes first, and then if it is not addressed early, it can progress into depression, which then increases suicidal risk. So this finding highlights the needs to intervene at the burnout stage, not just after the depression develops. Next, please. So now, post-pandemic, there's been growing attention to workplace well-being, and that's great, but there's still a gap between theory and reality. So the US Surgeon General and also NIOSH have both emphasized the total worker health framework, which integrates physical and mental health promotion at work. However, in practice, these frameworks often fail to reach marginalized groups, such as individuals with chronic illness. So, as some scholars point out, focusing too much on the individual coping, like telling people to be more resilient, something like that, that can ignore the real structural problems that create burnout in the first place. So the takeaway here is that systemic change is just as important as individual coping strategies if we want to build a more healthier workplace. Next, please. So when we look at this slide and through the syndemic lens, it becomes clearer. So COVID-19 wasn't just a medical crisis, but it was also a social and occupational crisis. So individuals with chronic illnesses experienced overlapping stressors such as disruptive care, stigma, and economic insecurity. So our findings suggest that we can't treat suicidal ideation or depression as purely individual problems, but they are deeply embedded in the broader social and structural conditions. So this means that prevention strategy should be multi-level, combining individual coping support, organizational flexibility, and broader policy reforms. Next, please. From these findings, we can draw some key implications. So first of all, at the individual level, intervention should target burnout before it turns into the depression. So web-based mindfulness or coping programs have been shown to help, and they are especially practical during restricted period like COVID pandemic. Also, communication and self-advocacy training can make it easier for employees with chronic illness to disclose their needs and self-advocate that, and then get accommodation at work. And secondly, at the organizational level, combining individual and system level strategies gives the most long-lasting effect. So workplace needs flexible schedule, better supervisor communication skills, and also inclusive policies. And lastly, at the societal level, policies that reduce stigma and improve healthcare access can build resilience on the larger scale. So overall, supporting mental health during pandemic requires a coordinated effort across all three levels, such as individual and organizational and societal level. Next, please. Of course, there are several limitations we should acknowledge. First, we didn't directly measure systemic or organizational support, even though our discussion implies that its importance. And second, since we used secondary data, we could only look at the general employment status, not specific job types. And that's a gap for the future study. And the third, the cross-sectional design limits our ability to draw causal conclusions about the sequence of burnout and depression. And lastly, our data came mainly from South Korean employees with chronic illness, so cross-cultural differences should be explored in the future. So moving forward, I think, and we think, longitudinal and cross-cultural studies that examines structural and policy influences will readily and deepen our understanding of how burnout and suicidal risk are interconnected. So that's all for our study and presentation. So here are some references we cited. So if you have any question or concerns with this study, please reach out to one of these email address. And thank you for listening.